Hi, everyone. Once again, here back, welcome. My name is Tina Costa, and I am one of the directors with the PHSA Office of Virtual Health. Lovely to be here as your host for these virtual sessions. My pleasure to welcome or re-welcome you to the 2023 BC Digital Health Forum. For those of you joining in for the first time this morning and into our virtual circle, we encourage you to share in our collective gratitude for the opportunity to come together from many traditional, ancestral, and unceded territories of BC First Nations. Let us continue as we move forward in this forum to give thanks for the opportunity to gather, to learn, to collaborate, and to provide care on these beautiful and sacred lands. I now have the pleasure of providing a condensed introduction to our next presenters. We have Kyla Pongratz, Dr. Marianne Morgan, and Kristen Korns. Kyla is a senior clinical leader at Provincial Digital Health Services, Provincial Health Services Authority, where she uses her expertise in model of care transformation, innovation, clinical service delivery, operations, and virtual health to facilitate and lead the discovery and implementation of virtual health within the clinical setting. Dr. Morgan is the Provincial Primary Care Medical Lead at Perinatal Services BC. She is a family physician who practices as an uninvited guest on the Silix territory, also known as Kelowna. With the Perinatal Services BC team, she has worked on creating the Perinatal and Newborn Health Hub, a provincial resource for all perinatal health care providers. Kristen is the senior leader for provincial education at Perinatal Services BC. With Perinatal Services BC team, she has worked on creating the Perinatal and Newborn Health Hub, a provincial resource for all perinatal health care providers. Please join me in welcoming Kyla, Marianne, and Kristen for their talk entitled here on the slide, the Perinatal and Newborn Health Hub. Over to our presenters.
Thank you, Tina. We are very grateful and excited for the opportunity to share this project with you today. So I would like to begin by acknowledging the Indigenous peoples of all the lands that we are on today while we meet on a virtual platform. We do this to affirm our commitment to reconciliation and responsibility in improving relationships between nations and to improving our understanding of local Indigenous peoples and their cultures that have cared for the lands that we call home. I am personally working remotely as an uninvited occupier on the traditional territory of the Haudenosaunee, Anishinaabe, and Attawandaron peoples, which is treaty land in Ontario. So far away from BC today, but I will be back in Vancouver next week in the traditional ancestral unceded territories of the Musqueam, Squamish, and Tsleil-Waututh First Nations. So if you can imagine for a second, the current state for perinatal and newborn health professionals in the province of BC, utilizing various sites and resources to deliver care, having to pay memberships for different organizations to access guidelines or clinical support, and arduous login processes, even accessing the PSBC website with long PDFs that could be outdated or maybe are outdated. We've all been there where we can't for the life of us recall our password. Did it have a special character? So finding resources isn't always easy when you really need it. Imagine again, the next generation. The Perinatal and Newborn Health Hub, or affectionately known as the Hub, an online clinical information resource system aimed at making evidence-informed, up-to-date clinical information relevant to the context of BC that is easy to find, understand, save, and share with colleagues from any relevant device in one accessible system. Perinatal Services BC, or PSBC for short, provides leadership, support, and coordination for the strategic planning of perinatal services in BC and is the central source in the province for evidence-based perinatal information. When speaking with clinicians, PSBC heard their concerns and frustrations and connected with the Office of Virtual Health, or OVH, at PHSA. As we know, the Office of Virtual Health leads and provides strategic direction and innovation for the virtual health initiative at PHSA. They work directly with clinical teams to provide guidance and support as they integrate virtual health into their services. And this is how the Hub project was born and how the partnership between PSBC and OVH began. There are approximately 20,000 perinatal and newborn health professionals across BC, supporting approximately 40 to 45,000 births annually within the province. With this project, we have aimed to reach and provide support and clinical guidance to all these providers, whether they work in public health, acute care, primary and community care, in rural, remote, or urban settings. The hub is the one-stop shop. The hub vision is to offer an online clinical information resource system accessible to all perinatal and newborn health professionals across the province that's easy to use and understand, providing current evidence-informed information, which is up to date and succinct, while also providing an opportunity to learn more with links to references, as well as the ability to connect and share resources with peers to support the provisioning of high quality standardized care for pregnant women or people, their newborns, and their families. The project goals were clear: make it easy to find, understand, save, and share the right information at the right time from any device anywhere in the region. Optimize content management to keep it current and relevant, and promote user awareness and adoption, making it a useful, user-friendly primary resource for all things perinatal and newborn care. Throughout the development process, the hub has used three guiding principles: a high degree of engagement with various partners and end users, taking an iterative and interactive approach and doing incremental and rapid prototyping based on partner feedback, and ensuring user stories drive the development and the design of the hub. It's been a long journey.
The project team engaged with end users to refine the requirements through surveys, interviews, and through an advisory committee consisting of provincial partners from various health authorities across the province of BC. Shifts in requirements have occurred over time due to resources, timelines, and clinical priorities, but many of the same hub requirements remain and will continue to be developed through web development iterations as the site continues to mature. The hub project was initiated in June of 2021. Partner engagement was initiated via online surveys, one-on-one interviews, and workshops. The list of requirements was developed, refined, and then validated through numerous engagement sessions with end users, the hub advisory committee, and the hub internal leadership team. Consultants were onboarded to support with prototyping and to start the design and build of the hub. The project team received the minimal viable product in April, and we continue to complete iterative builds of the site in preparation for launch. The hub went live online on October 19th, and the hub is scheduled for public release next week on November 29th. There continues to be quality improvement cycles through end user feedback and refinement in clinical requirements. In April this past year, as I mentioned, we received an early iteration of the site and embarked on site testing. We slid into pre-existing partner meetings and offered a variety of engagement sessions. Interactive demos were held over Zoom or Teams, and small breakout rooms were utilized with multiple facilitators. Clinicians trialed 4 clinically focused case scenarios and answered questions for our survey. We also gathered qualitative feedback within the small breakout rooms. Results were analyzed, prioritized, and then provided to the web developer to be acted upon. During this early iteration testing phase, we reached more than 100 clinicians around the province. At the end of October and early November, after approximately 6 months of site and content development, we sought to obtain user feedback once again. This time, it was more functional and in-depth clinically focused case scenarios. We asked clinicians to choose between 4 one-hour-long sessions. We also offered one-to-ones for those who couldn't make the meeting times. And we were able to reach, again, another 60 clinicians, which is pretty impressive during this process. We gathered yet again some really valuable feedback for the site improvements. We reached a wide range of providers during these engagement sessions from across BC. acute care, public health, primary care, and community care from across all health authorities, and engaged a variety of health professionals. The overwhelming response was positive. Healthcare providers told us they really appreciated being part of the process, and the project team viewed it as a very valuable partner engagement strategy for the hub. The qualitative feedback that we received working within the small breakout rooms was just as valuable as the survey results we received. And here are just a few of the comments we heard.
The really exciting centerpiece of this site is the evidence-informed, easy access educational content guidance. Our team is developing more than 120 clinical topics for use by healthcare providers. Clinicians from around BC are researching and writing topics. Topics are then reviewed at Perinatal Services by our interdisciplinary clinical review group. Then groups of 8 or more interdisciplinary external reviewers from all over BC meet to discuss and critique. Final approval happens within our team. Once the hub is launched, we will maintain and regularly update the topics. Our stakeholder, you can go to the next slide. Our stakeholder engagement sessions told us that content should be presented in a manner that is intuitive and easy to find, but also easy to read with clear and concise information. Here you can see an example of one of our clinical care topics. On the left, the topics are grouped under the heading Clinical Guidance and can be filtered into different categories. On the right, each content topic has an introduction and succinct key messages to summarize clinical recommendations. Key messages open up to show more detailed information. There are links to provider and patient resources. Items such as calculators, data visualizations, and algorithms are incorporated. Some of our challenges included engaging the large number of healthcare providers across BC required to support this fulsome content development program project in an already stretched system with over capacity. And then another challenge is migrating over all of our existing content from our PSBC website that we have now. There are over 1,000 provider-facing resources there. Any healthcare provider can gain access to all this information without a login. There are advantages to registering, however. These include saving resources, creating libraries with multiple resources, and sharing resources with peers and team members. We are currently working on approving final content and uploading everything onto the hub in preparation for launch. A big thank you to our PHSA communications team. And here we have a short video that we'd like to highlight the hub.
Welcome to the Perinatal and Newborn Health Hub, also known as the Hub. The Hub is a new online clinical information resource for perinatal and newborn health professionals across British Columbia. Why create a new online resource? Because care providers across BC asked for centralized, current and evidence-informed information to support them in providing high-quality, standardized care for pregnant individuals and their newborns. The Hub is being developed in response to those requests. Let's take a few moments to show some of the key features of the Hub. When you open the Hub homepage, you will notice the search field in the upper right-hand corner. The search field is a go-to for quick access to information. If you are looking to search for clinical resources and guidance, no sign-in is required. You can find information on cultural safety and humility, clinical guidance which has clinical care topics, forms, professional resources including tools and calculators, screening programs, education, tiers of service, alerts and updates, and access to provincial virtual clinical support consultations with an expert. Below the search field, you can navigate the site by using the drop-down menu in the top banner, the continuum of care, and by filtering within clinical care topics to access current evidence-informed up-to-date health information for every step of the pregnancy journey. The Hub addresses a gap in accessible clinical information in BC. Each clinical care topic has key messages with supporting information and evidence, provider and patient resources, as applicable, and references each of which that can be expanded to show more detail. Many of the current PSBC provider resources are being migrated over to the hub to support that one-stop shop for accessible provider information. PSBC migrated information can be accessed throughout the hub, including under clinical guidance within the professional resources section, cultural safety and humility page, the screening programs page, and the education page. For those who visit the site frequently, you may want to register and create a profile to customize your experience by saving and adding resources to your favorites or creating individual libraries to group resources together. You can even share libraries or specific resources with other colleagues. Whatever your role as a perinatal and newborn health professional, whether you are a clinician who has been practicing for over 30 years, a student, a researcher, or systems planner and administrator, the hub is your central source for evidence-informed information in the province. Welcome.
Thanks very much. And if there's any questions, we're happy to answer.
Amazing. Thank you, Kyla, Marianne, and Kristen for showcasing the hub and the great work that you're doing. It's yet another example of getting the right resources in the right hands right away, and just ensuring that equity of care across BC for our perinatal and newborn populations. Fantastic. I'm just going to check out the Q&As. I do have a comment in the chat, which is similar. Thinking about, so comment was another great example of a really, really useful tool, great work. A couple of questions from our patient partners, wondering about patient partner involvement versus just the clinical partner involvement. A couple other aspects, I'll read them out and you can let me know if you need me to repeat them. So the patient partner involvement piece and access in respect to, is it limited to just care providers or is there general public access?
You want to take that one, Kristen? I'll jump in. So this site is specifically for healthcare providers. And there has been some patient partner engagement. We do have a couple of tables through PSBC that are patient partners that are regularly engaged and helping in our work. There is another site in evolution.
Patient Learning Center.
Thank you. Yeah, Learning Hub or Learning Center that will be patient facing, that's being built at the moment. Not sure exactly when launch will happen. And our patient engagement team are super involved in that.
Fantastic. That's great to hear. What a complementary clinical model that you guys are really building from the patient side as well as the provider side. Wondering about, I'm just waiting, I think people are just chatting, putting in some questions, but wondering about for those of yourselves that have been working, probably Marianne and Kristen, particularly from the clinical side of things, what do you think the biggest benefit's going to be for the clinicians utilizing the hub?
So one thing that we're really hopeful about is that it's going to be accessible to those who have not been able to access any of this information without needing without meeting the firewalls and needing SOGC memberships and needing all of these different memberships. Plus it's at their fingertips. So it goes to rural and remote areas as well. So I think that's probably one of the biggest benefits, is that this information is going to be standardized and it's contextual to BC. So it's not just, a guideline that was developed in the US or a guideline that was developed somewhere else and we're trying to adapt it. We've engaged with our local subject matter experts who have experience and who have put their experience into these clinical care topics. So it should be the most relevant information for clinicians to date, I guess.
Great. Anything to add, Marianne?
No, I think you just captured it all. I think it's equitable access to the information and yeah, leveling the playing field so that everybody can access it, teams can access it, all kinds of different healthcare providers.
Fantastic. Now I see you typing in the next question, but maybe I'll ask it aloud if that works for you. In the title talk, there is the reference to real-time clinical care information. What type of information might need to be updated in real time on the site?
I don't know that there's any information that needs to be updated in real time. There is real-time access to support. So in partnership with some of our other partners, in particular, the rural centers, they have virtual access to supports that people from rural sites will be able to access. So you can also get there from our site. So trying to make everything available perinatally from our site. So that's help with perinatal and newborn.
Fantastic. One last question we've got here is, what were the major challenges and barriers when building and implementing this particular product?
I can start. The project has gone on for a few years. So with time comes changes in kind of priorities or clinicians. So the hub has evolved and matured in its design and its requirements over the years. I think it's the content that really shines through as being the key feature, making that as accessible as possible and as concise as possible, so busy clinicians can access that whenever they need. And so making sure that that has been and will continue to be the spotlight of the hub. So easy access to what you need, when you need, from any device around across the province.
Wonderful.
I'll just add to that a little bit. For us, it was like also knowing in the clinical area where to stop, because we just keep finding more and more topics we could possibly
Yes.
develop, but there's only so many people we can access to write these topics. There's only so much time we have to get it all completed. And the review process was quite rigorous. So it took a lot of time and a lot of convening a lot of people to get together. We had external review groups with, professionals across the province, and they have very busy schedules. So getting them all together in one group across, I think we had like 10 different groups at least. And so that was challenging. And then also for particularly Marianne and I is learning web language. We had no idea what any of this stuff meant as clinical providers. So that was very challenging, trying to understand web development language.
So kudos to Kyla, whose job it was to connect us all.
Yeah, that's fantastic. It really does need that conduit between the clinical world and the technology world. And we're starting to see that converge like we are with something like the hub. It's fantastic. Just wanted to reiterate, it's not a question, but just another comment from one of the audience members. Wanted to say that the site looks really good, beautiful design, and clearly a ton of great information on it. So thank you guys for your work on the hub. We will close the session now, and we'll bring up the Zoom poll for those to give us a bit of feedback. Please feel free to do that. That's great. Really appreciate the time that the teams put into this particular project. We will invite you to our next session. And so the next session is entitled Fostering Diversity in Perinatal Research, a bit of a theme in the perinatal population today, which is fantastic. Again, you can navigate to the title on the panel on the left-hand side of your screen, and we hope to see you there. Marianne, Kyla, Kristen, thank you. Thank you. Thank you.